Again, the pandemic seems far from over, and one of the biggest concerns is protecting and taking care of our community, who is the most vulnerable to the virus. Depression, anxiety, loneliness, fear, and isolation from family are just a few things our elderly population is feeling during the pandemic. Now more than ever, it's important to reach out to your aging family members. And for today's 10th segment of Center Solutions COVID Edition, I spoke with our mental health experts from the Centers for Children and Families, Christy Edwards and Melanie Size, on ways how you can reach out to your loved ones and signs to look for to help seniors in your life cope while in isolation.
Our elderly population, who are so high risk for many things, I think they're going, okay, so do I let my family come see me? Do I let Meals on Wheels deliver to my house? When do I know when to call the doctor? So a lot of times you do see them, they basically just narrow their lives to where it's just them in their home, you know, watching TV and doing nothing. So what we want to be able to do is convince them whenever, you know, we are working right now with Senior Life for a way to, for the elderly to reach out to us without having to come into our offices, just so we can talk to them, find out what their needs are, find out if their anxiety or their fear level is to a level that we might need to talk to somebody about medication. Or do we just need to be talking to them on a regular basis, just checking in? Do you have food? What, you know, kind of what is your greatest fear? What are you struggling with right now? We can ask all those hard questions that sometimes families are afraid to ask. We're going to ask those. And then we're going to be able to connect them with the appropriate resource.
Edward says that it's important to be aware of signs that your loved one may need help, especially radical changes. It may be time to step in. But every time you call your parent or grandparents, it's important to regularly ask the same questions to evaluate their health.
The first thing that you should ask is, and they should expect this, are you eating? And then if they say yes, then ask them, what's the last thing you ate? What was the last meal you had? You know, are you drinking? Are you getting dressed? Are you going outside? Are you doing things that you've normally done? I mean, you know, if it's, you know, I know we're isolated right now, so if it is a jigsaw puzzle, if it is watching Jeopardy or any of the game shows on, are you doing any of those things that you normally did that you got some enjoyment from? Are you calling your friends? Are you anxious to get back to playing dominoes with your friends, or, you know, whatever it might be? If you're not getting good answers to the majority of those, it might be time that you start encouraging more. It's not always an intervention that requires that you come swoop in and take them to the doctor. It is just you know, why don't you get up? Why don't you go for a walk? You know, or I'm going to have some food delivered to your house that has some fresh fruit and vegetables. I want you to make sure you're eating that. And if they have the ability, it's always a good idea. Why don't you have them FaceTime you while they're eating so you can see what they are eating? And I think a lot of older people don't drink as much water as they need to, because they think, oh, I have some coffee and, you know, I had a drink of water with my medication, but that we're encouraging them to stay hydrated at this time as well.
And our experts say it's important for your family members to know that you have a plan to help take care of them. By letting them know when you are going to call, stop by, or contact someone to check in on them, it helps. Edward says that clear communication and consistency reduces your loved one's fear and anxiety, knowing they're going to be taken care of.
I really do think it's important, for example, for family members or friends, if you have other people that you know, say if it's family and it's your parents, get together with the other siblings or aunts and uncles and cousins so that everybody can be a part of that communication bubble.
I think for the elderly population, they're spending a lot of time remembering the things that they did. They're hungry to share that. If you can sit down with somebody for 15, 20 minutes and just say, you know, I know you've been thinking about, tell me something about when you were a kid, or, you know, tell me if you remember ever going through anything like this before. Just give them a little bit of your time. You're going to be enriched by it. They're going to feel great that they've been able to share something that has been on their mind. And I just think everybody wins in a situation like that.
And we want you to know that you are never alone, and if you need help or are experiencing feelings of worthlessness, helplessness, or even suicidal thoughts, you can call the Emergency Crisis Hotline, available 24/7. We have that number right here on your screen, 844-420-3964. And during the month of July, the Centers for Children and Families is offering free sessions to all first responders or medical workers battling COVID-19 on the front lines. And for contact information and a link to the full Centers Solutions podcast to learn more about taking care of your elderly family members, head to our website, yourbasin.com. There you can also hear more tips from our experts.